it's my utmost pleasure to introduce Dr. Ashok Seth to all of you. I'm sure none of you is not aware of this big name in cardiology. If any of you is doing cardiology, I'm sure the day you enter your DM course, you know this name. I did know this name in 2001 when I started my DM in Sion Hospital, and I still hear his name as one of the finest and most skilled cardiologists in our generation. Now, with that, I'll give you a formal introduction. Sir is a chairman of Fortis Escorts Heart Institute, Chairman Cardiology Council, Fortis Group of Hospitals. Sir is the president of Asian Pacific Society of Interventional Cardiology. He is a past president of Cardiology Society of India. And during that tenure, sir had a lot of endeavor to promote academic excellence in most of the students undergoing cardiology course. He has been a pioneer in so many interventional techniques that it would be really difficult for me to really squeeze in this period. But you name a thing, you name angioplasty, you name stents, you name scaffolds, not stents, bare metal stents, too, drug-eluting stents. Sir is pioneer in all of these things. Starting from a simple angioplasty to the complex, most rotablator, whatnot. I have few common patients with sir, and I can assure you there is nothing in interventional cardiology what sir doesn't perform. Now, with this, sir is a wonderful teacher. We hear him in all our conferences. We have seen doing live cases. And it's always a pleasure to be associated with you, sir, to hear you out. And I'm really feeling honored to be a part of this platform. With that, sir, should I start my few questions? And please feel free to share any kind of things. I mean, we can always extend our time period. There is no time frame, actually.
Thank you, Dr. Ritu Bhatia. Indeed, it's a pleasure to be talking to you. Thank you for that warm and very nice introduction. I, for a moment, thought you weren't talking about me. I thought you were talking about somebody else. That introduction was so good. But yes, it's a pleasure to talk to you, and I'm very happy that we can speak on this forum.
Sir, usually I start my interview with a question like, how was your childhood? But we were just discussing earlier also, I came across an anecdote where you had that inclination of being a doctor at the age of 4. Could you please elaborate?
Yes.
And I think your dad is a doctor. That's why you kind of got to...
That's true. And my dad is still a doctor. He's at 97 and a half years. Wow. And till a year ago, he was practicing before the lockdown. And his last patient he saw was around the 15th of March last year. And then, of course, I stopped him from seeing more patients because of the COVID. But he intends getting back to it. Yes. Now, it's a very interesting story of my childhood. There are two of them, in fact. One was that I was I don't know what was in me. There must have been some genes of becoming a doctor, which I perhaps could not see because my sister, who is 1.5 years older to me, had a doll. And I decided that the doll was sick. And I just made up my mind, and this was at the age of 4, that this doll is sick and she needs to be treated. And there I was with a syringe and needle, and I must have given her at least 300 injections. Wow. At 2 hours, saying, no, she's not getting better. I've got to give her more injections. She's not getting better. Till the doll had a hole at every point. So my sister came, and then my sister saw her doll, and she started weeping and crying and telling me, why have you done this? Why have you spoiled my doll? And I said, you don't realize the doll is very sick. I still remember, you're very sick, and only I can make her better. And don't cry, she will get better.
Wonderful.
And the doll obviously never got better with all those holes which I drilled into the doll. But that's a story which my sister and I always remember and laugh that the doll never got better, even though I promised to my sister that she'd get better.
So you were a confident operator even at that time, sir.
But I didn't get her better.
You were confident that your patient is going to do well. I mean, this is, I think, the most important quality.
You're so right. then what happened was, when I was, I think, 6, and we had this neighbor. I used to play with that boy who was again 5 years old, and I remember my dad had a scalpel set, and he would keep it very high above an almirah, and it had. He used to, use, before he became a physician, he was general practitioner. He used to do cataract surgeries, and there was scalpel, and there was forceps, and there's all. And I used to be very fascinated by looking at that set, opening it up, all scalpels, etc. And then my friend, after we were playing, he said he's got a pain in the stomach, and I said, "What? Pain in the stomach? Now come, I know how to treat this." And so I got him to lie down, and I said, "Listen, what we need to do is I need to see what's inside your stomach." And so he laid down, and I covered him because I'd seen this happening, that this is how you do, you cover people up. And then I went up, I climbed up, I put 2 stools, and I climbed up, got that set out. And I got that set out, and I took the scalpel blade out, and I said, I've got to actually now open you up and actually make sure that we find what's causing you the pain. And it is just fortune that my father actually just arrived as I was taking the scalpel out, because I was ready to operate upon him. He was 5, I was 6. Maybe I would have been the youngest ever surgeon to have taken out a gallbladder. Who knows? But I think fortune saved him. The moment he realized what was going to happen, I think his stomach pains got better. But again, my father was horrified. I think he was horrified. He said, "My God, had I been even little late, what would have happened?" I don't know whether I would have gone ahead, done it. Was I playing? I still don't remember. But it was actually, that was the event. And yes, my father still thinks that is the seeds of becoming a doctor in me that he saw.
Right.
Yeah, those are very, very lovely stories of how my childhood passed and how I was adventurous, should we say, at that time. A pioneer, like you said.
Right, sir. And your schooling was in Delhi only, sir? You had been raised in Delhi?
So this is interesting. I'm a true Indian at heart, where I was born in Bihar, in a small town in Bihar called Sabor, which is near Bhagalpur. I did my early schooling in Muzaffarpur in Bihar. I did my subsequent schooling in Durgapur, which is in West Bengal. I did my medical college in Aligarh, and then went abroad and did my subsequent education abroad. So I do represent and I'm from Punjab. I'm originally from Punjab. So I do represent the cultural mix.
That's
and
right.
the true spirit of
Right.
being an Indian.
Lovely. Sir, in one of your interviews, I think it was in Aligarh, but I'm not sure. You mentioned something about not getting into med school in 3 attempts. I was actually astonished, not because you did not get. I mean, by your humble gesture. I mean, you weren't hesitant in sharing it with all the people around you. And could you elaborate, sir?
Yeah, I'm not hesitant in sharing it, because that's true reality of life. I do believe that people should get inspired by such events, because we have a lot of youngsters who are so dedicated and devoted that if they don't get what they achieve in that short frame of time, or they don't get into college, to a medical college the first time, or they don't achieve what they wanted then the first go, they get very dejected, very depressed, and it spoils their whole, in a way, they almost feel that they're doomed. But that's not the case. And mine is a true example. I'm probably the only person, I must tell you, who's done 3 pre-medicals before getting into a medical college.
Sir, I'm sure there must be many. You are probably not hesitant in sharing it. Otherwise, I think
you'd be so surprised at my career that I actually should have. I did my higher secondary in 1971, and therefore pre-medical that year, and should have got into the medical college in 1972. But I couldn't get into the medical college till 1974. I did not get through the entrance exams in 72 after the pre-medical. So I started doing a BSc second year. By doing BSc second year, I actually still didn't get into the medical colleges in 73. And my father therefore said that, and I said to my father, I've had enough. He said, no, you were destined to become a doctor. He said, you've got to become a doctor. And I said, listen, I don't think this is getting anywhere. I can't keep taking these exams and not getting in. I'll do BCom. Okay, so what did the parents think at that time? You know it. This is going into the 70s. There were only two branches your son, your children could go for. It's either a doctor or an engineer. The rest all seemed to be absolutely nothing. So when I said BCom, and I thought I was getting smart, that I was thinking of new directions, and I thought he'd appreciate me, he screamed at me saying, "Kya clerk banna hai?" And I went into myself saying, what, doesn't he realize there must be more avenues to this life than just becoming a doctor or an engineer? But anyway, I persisted, and finally, the only medical college I got through on a second waiting list, number 7, was Aligarh Muslim University. And I'm happy that I got in. And that just shows, yes, that I don't think even at that time, well, I wasn't too dejected. Yes, I was dejected that I was not getting through, but I knew that I'd make whichever line I took, I would be fine at it. It is just a phase of your life. It's time that I was not so intent and focused in what I wanted to achieve, though everybody knew I was intelligent, but my focus wasn't there. I wanted to have fun in life. I wanted to enjoy life. And that was, clearly my diversion at that time. And of course, even when I got into the medical college, the story is very clearly, I wasn't I wasn't so focused to even pass through my internal examinations in the first year and a half. And that's our as we come to the first professional, I wasn't expected to do well. I was having a fun time at the medical college. My parents had gone away abroad, and I was here nicely alone, enjoying life because they were in Zambia. And then lo and behold, while I failed all the internal exams or didn't do well in the internal exams, yes, I still remember the whole incident where after the first professional, my friends walked up to me in my room saying, listen, you need to see the result of your first professional. And I said, what? I should have failed, or perhaps I must have just somehow scraped through. And they said, no, you've actually topped. You've got a gold medal in anatomy. And I said, I knew that they were pulling my leg. So I said, no, give me a break. Let's go have some tea. Let's enjoy ourselves. And they said, no, you have. And I didn't go on. I didn't even go and look at the results. You remember you could be to go to the notice boards to see all the names there and who came first. Yes. And I didn't. And then in the evening or somewhere around 6:30, 7 o'clock, I decided I might as well go and see this notice board. Too many people are saying the same story. They must be wanting to fool me, but this is getting a bit out of hand. So I did. And I got myself. I was actually topped the anatomy. And I didn't do badly in others as well. And I said, that's a gold medal in me. And then, it was actually astounding to a lot of people that I'd actually got the gold medal in anatomy. But then the biggest interesting aspect is I went to the professor. It was customary to go to the professor at that time, the head of department, and say, thank you very much. I'm so-and-so, and I've got the medal. And he'd say very nice things about you and say, congratulations. And, you build that bit of appreciation up. And I went to the professor, head of the anatomy, and I sat in front of him, and he said, who are you? And I said, I'm Ashok Seth. I topped the anatomy exam. And he stared at me, and he looked through me. He said to me, Dr. Sahab, aapne top kiya, but ye hua kaise? Aapne kaise top kar liya? And now that was a sudden shock to me. I said, here's somebody supposed to appreciate what I actually achieved. And all he can start is wondering, how did I top it? Sometimes what happens in your life is that you suddenly get a shock, a jolt, not a shock. You get a jolt and you say, gosh, I think I've got to do better. If he hasn't got a trust in me, if others believe that I must have somehow got a chance or a luck that I actually topped, I have the ability. I can do it. But they don't realize that I can do it. Now I said, once you achieve that, you say, if you drop from that pedestal down, then you'll either be ridiculed or you will not be looked upon as an achiever. And I decided that day that I will never, ever, I will always stay on the top. I will never let that go down, because you will either be laughed around or be ridiculed, or your credibility goes. And from there on, I did. I still had a good time. I enjoyed myself. I was fortunate also to find my life partner in the same class as myself. We've had a good time in our lives, and I'm thankful to Aligarh Muslim University and Aligarh for that as well, for creating most of my life. And then most importantly, yes, I topped. I had gold medals in ophthalmology. I had gold medal in medicine, and I did have an illustrious career after that. So I think, so this is to be known by everybody, that there's always that fire in you. There's always the light in you. If you're a person who got into the medical college, there is light. And there's always going to be light. You'll never be dejected, never be disappointed. When you start focus, when you actually say, I'm intent, and then you can actually achieve everything that you want, because it is there inside you. It just needs to come out at the right time. And nobody needs to be disappointed at any failure. The failures are never only to be forgotten, to move on to the next, provided you've got your heart in the right place, provided you've got a focus, dedication, and devotion to what you want to do.
Wonderful. So thanks for such encouraging words. I'm sure they're useful for all the students who are in either med school or pursuing cardiology. Sir, I just read that you, at one point of time, you wanted to leave cardiology and go into gastroenterology.
See, let me say right up front and in the beginning. At some stage, you're going to ask me, how did you achieve all this success? And let me just tell you very clearly, I'm a success of a default strategy, I call it. I never even charted this path out for me. I'd never even wanted or dreamt of getting to the position I am. It happened automatically. It was, I guess, in some ways willed. For example, you asked me this very important question. So in England, I did a rotation, as they say. There's, you spend a year each in two subjects I did in my training years. One was gastroenterology, the other was cardiology. And then you decide about which branch that you want to move up into as you get into registrars and senior registrars. And I was not even intent on cardiology. I said, who wants to listen to heart sounds with a stethoscope? That's a boring job. Gastroenterology seemed very fascinating. There were things to do at that time, endoscopies and ERCPs and colonoscopies and taking gallstones out. And I wanted my hands to work. And the only thing you could do at that time in was an angiogram through a little cut down of a brachial artery at that time. And I said, this is boring. And echoes and M-mode echoes. And that was all that cardiology was. So I said, cardiology to koi bhi kar leta. And so I wanted this gastro job after this, this prestigious job at Liverpool, which was one of the best for training in ERCPs. And I was an accomplished gastroenterologist. I'd done 1,500 endoscopies, acute GI bleeders. I created the on-call system. I was very intent. And I was clearly outlined for the job. I was in a teaching hospital. I was clearly outlined for that job. And then the job did not go to me for numerous reasons, which are well understood. And then it suddenly seemed a bit of a downfall for me. And I said, what do I do now? You get so intent on doing something, which is what you're aiming for the last year and a half. And you believe that you'll get it because you're the most suited person. Anyway, it didn't happen. But then, as a fallback option, my professor of cardiology, with whom I'd spent a year, said, we got a job in cardiology, why didn't you take that? And that was after my SHO training, the registrar job in cardiology, why didn't you take that? I said, cardiology, I don't want to be a cardiologist. But I thought it was a teaching hospital. He's actually offered a job to me as a foreigner, and that's why, people said, you must be crazy if you're not accepting. So I said, okay, let me just take up the cardiology job. Let me become a cardiologist if I can't become a gastroenterologist. And as would have it, the same university teaching hospital became the third center to start angioplasties in England. Never think, I didn't even know what these angioplasties were. I didn't even want to train in something like what's called an angioplasty. And then the senior lecturer and I became such close friends that I became his first. He was also learning angioplasties and I was his sideman. So we together sort of developed angioplasty practically in Britain from the early onwards. It's fun because he's very intelligent, and that's Manfai Shu, my mentor. And of course, I sort of therefore learned angioplasty working with him because that was the third center in UK, and little realizing what it was going to transform me. It was going to transform my career, that it would actually be an arena which would take over not just cardiology, but create a new era of interventional cardiology, a new specialization of interventional cardiology. Not that I didn't realize at that time that it would become one of the most important fields in medicine in times to come. So you can see what a default strategy. I just learned angioplasty because it was thrust on me. I didn't even know what angioplasty was. And then of course, the whole career started in realizing that this is fascinating. This is a technique. And then I went so deeply into that technique that I believed that this was actually the future. And then my dedication to that technique was so strong that I believed that we could be able to do anything possible with even those crude techniques in those days of balloon angioplasty. And that is the reason why we persisted, we were focused, we were determined as pioneers of balloon angioplasty to get interventional cardiology to the present days as we see it in India.
Lovely, sir. Sir, I think you left UK because your mom was not well. I just had a glimpse. I mean, what really went wrong? And
so my parents were in Zambia, as I told you, and my family, we were all doing well in the UK. I never wanted to come back for any reason. This was a teaching hospital, was intent. And then, of course, my parents returned, and I'm the only son. My mother didn't keep good health. She was always very sick. There was a number of problems and physical problems that she had. And then finally, I decided that if I had stayed back, then I would always be repentant in my life about not being the only son and not being able to take care of her. And so we made this harsh and very difficult decision in our lives, where I had perhaps 1% feeling of returning back to the country. No, I love my country, and I'm not saying it for that reason. But the fact that we were so well entrenched that there was no thought of returning, right. I would say, though I'm happy that I got back. There was no thought of returning at that time, 1%, and my wife also didn't think that she'd ever return back to the country. And then, of course, we decided that we had to do what we had to do at that time. And therefore, made that decision, came back in very difficult circumstances. And then because came back for my parents, there was never a looking back. Though I held my residency status in the UK for the next 20 years, I still never ever dreamt that I would even step back and go back ever to Britain, because I had come for the sake of my parents, and that was not going to change. So that was the first. And of course, I'm actually happy that I came back for my parents, because the satisfaction of doing those pioneering work from your own country, being recognized across the world from India, is a much happier and bigger satisfaction than, say, being in England and America and being recognized as an Indian American from America. I hope you would understand. I'm happy and proud to say I'm an Indian, and the world recognized me. From Dr. Ashok Seth from Delhi, and not Dr. Ashok Seth from London or New York or somewhere else.
That's it. So I was seeing one of your interviews with Vinay Mathur. Delhi, something Delhi. I mean, my heart is in Delhi. I mean, I considered you a real Delhiites. I mean, from that interview, I never realized you were from Bihar, and I mean.
So the connect with Delhi, of course, is when we returned back, and Ashoks Heart Institute was about to start, and of course that's how this decision of moving back came, because I could see that we have a center which we could develop, which we could actually excel, which we could actually do exactly what we'd learned, which could take it much further and much higher. And that satisfaction of a return back to your own country, being able to do everything that you'd actually practice abroad. So it was like setting up new standards for the country. And you know that Ashoks Heart Institute set up standards for this country, which then everybody wanted to emulate. And that's what the biggest happiness was. Yes. So that's how we settled in Delhi. And yes, Dil ki Dilli hai. It has made me what I am. It's provided my family with its love, affection. And yes, it's also given me the love and affection of India. So yes, Delhi is where I am for the last 32 years, and truly a Delhiite, as we say. Delhi to dilwalon ki hai, Delhi pure Hindustan ki hai.
Right. So I heard you talking a lot about subsidized healthcare facility for Indians. Could you elaborate a little what you really want to see in future from health services or health system?
Yeah, I think we have to, unfortunately, and I must say that you know it yourself, that the last 30 years and even more, the private healthcare has actually been tremendous in providing those facilities to the country which perhaps we would not have seen otherwise. The highest level of technique, technology, skills, expertise, care, outcomes, as good as the West, and at a much cheaper cost than the West, so that we've not just trained the world. Many patients from across the world come to us for those treatments. But at the same time, I also feel that this vertical should not ever be seen as an alien vertical. Quite often, the private healthcare becomes a whipping boy for everyone in terms of forgetting that amount of highest level of expertise, care, and techniques that we actually perform, saying that, but many people can't afford it. And actually, we want to amalgamate the two systems when we say we can't be two rail lines. The public and the private cannot be like two railway lines running as if they're meeting at a distance, but only running parallel and never meeting. Healthcare has to be comprehensive and provided in a much uniform and same manner so that we upgrade all the standards of even the public hospitals in the same manner and private hospitals. So I do believe that healthcare has to be subsidized. And if only we can get to a subsidized healthcare where cross subsidies happen, where care goes down to a much lower cost. But remember, free care is absolutely impossible. To think that care or medical services can be totally free can happen only for a small proportion of people. But it's certainly rich can subsidize poor, so that healthcare is not free. Healthcare is subsidized, because even if Britain could never provide free healthcare to all its population, that National Health Service is falling apart with six years of waiting list. And the same happens and when you look at the extreme models of United States, which is paid healthcare or which is insured healthcare, there are numerous people who can't even afford that sort of healthcare because it's just too expensive. So you come back to our country and you say, there are models that we can actually do. It just needs close public and private partnerships. It needs sitting around the table. It needs trusting each other in what you do. It's all the stakeholders believing in one, that healthcare has to be one. Even the poorest person in this country should be able to afford the best of the care and the most advanced care. And we just have to have the solutions around it. There are solutions around it, and I must say, government is working more and more towards it. But I just believe that this is an area which has to actually have such a focus that it should become the national agenda. And I hope it will become the national agenda for the future.
Very rightly said, sir. Sir, another thing which I thought you felt close to was the med students in the medical school. We are not inclined towards research. I mean, for an MBBS guy, it's kind of alien subject only. I mean, doing a research or publishing a paper. Why do you think this exists, or you think we can do something about it during the formative years only? We can, by teaching them similar or having a separate subject. What is your advice to the?
So there are multiple aspects to it, and let me start off by the most fundamental aspect of it is why was a research an integral part of every doctor in training and subsequently abroad in the West, be it Europe, be it UK, and be it USA? It's only because it gets valued. I knew I was doing so much of research, was entrenched into research and academics straight away, even during my training period and then as practicing cardiologist in the UK, that it was an integral part of my growth and of my credibility. I wasn't going to be critical just because I did angioplasties. My science, my technology, my research, my academics, and my seminal trials and research work that I did would actually exemplify what I am as a whole expert in my specialty. And the growth was also related to that. My promotions would be related to that. My promotions would not be related to the number of cases I did. It was related to my academics, my research, my science. It is an integral part of this being a differentiator amongst many equals. But it's rewarded. It's rewarded financially, it's rewarded in position, it's appreciated at various meetings, it singles you out as better than others. Well, unfortunately, that's the first part of it. Secondly, you're taught research in a very academic and very scientific manner. You're then able to integrate that into being the highest standards of research, and the research is divided into multiple standards. That has to be taught right here. And finally, there's finances involved for research. So if we actually put it into our Indian perspective, yes, our MBBS programs have to nurture research as a subject, has to train people in the highest levels of research, how to perform, what are the statistics, what actually analysis does one does, what does it mean to actually have a significant value, what is the number of patients needed in each group to achieve that significance, superiority or non-inferiority. There are many aspects which have to be taught. Once you've imbibed that, you have to have opportunities set up for research, for high scientific research. One needs to be able to reward those research, and not just that. We need a lot of money to be pumped into research, not through just companies and private enterprises, but the government should actually make it a clear agenda to put in money into research, to value research, because they have to show that we value academics, we value research, we value science, and that is where the future of India lies, to be above everybody in the world in clear, pivotal, scientific, leading researches, which puts India on the world map. Once we actually have this whole milieu, with government being a partner into it, we will then be able to deliver what we want to the rest of the world. As you know, India is best at doing. India is best with skills, techniques. We're very good. We are more skilled than anybody else in the world. But we also but our best thinking hats come out when we go to the West. They don't happen here. We need both to happen here. We need to be both skilled as well as the biggest thinkers and researchers. And I think that's what's needed in our country.
Sir, any suggestion for younger people who are doing cardiology? You have seen the full spectrum from angioplasty to TAVR to all the kinds of structural heart disease problems. Any message to the youngsters?
Yeah, loads of messages, to tell you frankly. Okay, let's just start with every aspect of the message. Let's just start with my career. And you said, yes, I pioneered numerous techniques and technologies, yes. And each of those, I had to have a belief. So I had a belief in the techniques, I had a belief in technology, I had the belief that I would be able to have the best of my capabilities and I would have the best outcomes. But firstly, I must tell you that when I stand at this, and a lot of people, it's very funny. Let me see. I gradually, over the years, got to this level without even realizing what level I was getting to. I was clearly intent, focused, dedicated, spent 24 hours out of, I would spend 26 hours out of 24 at work. I was blinkered, and there's only one thing in my life, and that was patience, patience, patience. I had to give my best to the patients. So I kept on doing things. Every aspect of mine just moved ahead. There was a lot of support from my family, my wife, my children in all this, their sacrifices, as I grew and grew, but never realized I was growing till I stand in this pedestal, where when someone comes for an interview and sits in front of me, just like you said, that I have probably become iconic for everybody who goes into cardiology and says that's what you want to be. When they sit in front of me and I interview them and they said, my only dream was to actually just sit in front of you and be able to talk to you. And then I say, are you sure that they mean me? Are they really talking about me? Because I still don't feel that I've got to that level where I've become synonymous with so much of excellence and techniques, technologies worldwide. And yet true, when I look back upon my career, that's a lot. So how did that come about? Like I told you, default strategy, isn't it? I started saying I'm a success of default strategy because I never went on, that was not a path. I never at one stage thought that, I've now come back. I want to be the greatest, the biggest ever that walked the scene in the country. That is not the way you think. You just say, let me just get entrenched into what I have to do, and I'm just going to do it to the best of my capabilities. I'm just going to continue on, and my focus was patience. So what does it do? I'll tell you. And I'll also tell you, success may mean different things at different times and different lives. So here it is. I would say, if I was to focus, say, what are the ingredients to my colleagues? I say, never aim. Always there has to be a focus. There has to be determination. There has to be ethics. There has to be credibility. And you have to be very good at your work. So that's the basics of. You may become successful, you may not become successful, but that's got to be the single fundamental point. Without hard work, without focus, without dedication, without passion, without ethics, you can't be successful. And then the second aspect is, remember, success is not due to you. It is actually includes sacrifices of a lot of people around. your family, your wife, your children, your others, your parents, who all sacrificed something or the other to provide you with that time so that you could devote it to that particular, to whatever you wanted to do. So that's there. Then you have actually the blessings of your parents and your peers and your, I think we are lucky we are in a profession that every day we get blessings of our patients every day. Can you believe that we are, without doing any extra work, we continue to get blessings of so many day after day after day. And we just have to be thankful that we're in such a profession that it automatically allows that. And so I guess that counts. But what counts most is the will of God. I mean, there was no reason for me to have even gone into medicine. When I say how I got into medicine, how actually was my biggest disappointment and sadness of life when I didn't get into gastroenterology. I thought the world had shattered around me. When I became a cardiologist as a default, it seemed I had lost a track of my life, and that for years in my life I would just be a cardiologist. That was what happened at that time. And finally, I was thrust into a situation where I didn't even know what angioplasty was when my professor said to me, that's what we're going to start doing, an angioplasty. And I said, that blowing up balloon thing, do you think it'll ever work? So it was not as if it was my intention to learn that. It was not that I went out there saying, I want to become an interventional cardiologist. Something was thrust upon me to become an interventional cardiologist. I did want to return back to the country, and I did. That was a default strategy. It was a default strategy that Ashoks Heart Institute was opening at the same time. And we got together to decide that this is where I wanted to be, and this is what we had to create. And here I am, just focused, determined, and I'm at a pedestal sitting there looking back upon my life saying, but I never aimed for this. I never aimed to get where I am today. And how did it happen? And that's what I said. It's the will of God. Because without that will, you will not get what you really deserve or what you should get. There was this, in simple terms, I'll tell you, I was actually at this, you have these gurus, you have these management gurus who actually come and give you wonderful lectures saying how to create success out of your lives. And you have everybody sitting around and, they're flamboyant and they will tell you lovely stories as to how to create success out of life. And he was giving this lecture saying, listen, this is how you create success. And he says, you just have to have 4 things. You have to have a map. Create a map. Decide exactly from today to 20 years how you want to become a success. In that map has to be genuine. You just can't dream. You actually have to, so the map has to be genuine. Then you follow that map to a T, do everything. If it says 5 feet, do 5 feet. If you say in 1 month, you got to do this, achieve that in 1 month's time. And then finally, you have to have a treasure at the end. Your goal has to be there. You've decided on your goal. It has to be there and you will achieve it. You follow these 4, you achieve it. And I said, okay, so I'm going to now tell you. So you have a map. And I said, I've got a map. I said, it's a genuine map. It tells me there's a treasure and I know it's genuine. And he says, follow the map to a T. So I said, I follow this map to a T. It tells me go 1 mile. I go 1 mile. It tells me to turn right. I turn right. It tells me I go another 300 meters. I go 300 meters. And it says, you'll see a tree. It says, I see a tree. And I said, I'm following it exactly. The map is absolutely genuine. I'm following it to T. It says, now dig down 20 feet. And there is a treasure there. And there's this huge box of gold lying there. And I said, I've digged down 20 feet. And I find this huge box of gold lying there. And I said, wow, I've done it. I've actually got the biggest success. That's what I dreamt for. And I opened the box and I hit the hammer on that lock, which was on the box. And the lock flies and hits me on the head. And as it hits me on the head, I slip and fall the 20 feet. I bang my head. I'm in a coma after that. I never wake up. Then what happened to that treasure? Why didn't I get that treasure if it was all that simple? I was there. I should have got the treasure. How come I actually slipped, hurt my head, went into a coma, never to see a treasure? Now you sort that out for me, and I will know that I can plan my success. Otherwise, the success relied on him. There was no reason I can slip down, going down the stairs every day, fall, hurt my head, never to wake up again. And that greatness of Dr. Ashok Seth would be gone in a split second. He would not be there anymore. So this
So, sir,
greatness
you
is
are a
absolutely a creation of his.
believer.
And we can be just thankful that he got us to sit and become iconic and inspirational to others. Perhaps that's the biggest gift he gave me. He gave me my skills, and that's why I always pray to him before I go and do any procedure and thank him afterwards. But he also gave me the situation to be inspirational and iconic only for simple reason, because he created me and he can destroy me even tonight. And then Ashok said,
so you are a strong believer in God.
I think he did it for me. I think he just, there's nothing I did. It was the default strategy. He wanted me to be where I am today. And I never did anything more than the 4 points that I told you.
Sir, your children, I mean, they are also believers. The
Yes,
next
no,
generation.
they're all believers. They're all very, very much believers. When you say the success, I would just this is another perspective which everybody needs to understand. The success is what you perceive.
Yes, very right, sir.
It is what you perceive of me. So at one stage, the success in a person's life could just be saying, I want to be the biggest and the greatest. And another point of life, it may be, I want to earn money so that I'm comfortable and that I achieve. On the third point, it may be, oh, I wish I've had so many awards. That could be a success. And finally, a success could be that have I done enough for my family and for my children? That's the success. It actually means to you as an individual, success is an amalgamation and may mean different to me in different times of life. But success is a perception, and a success is a perception of what others think of you. You should never say I'm successful.
That's right, sir. Very right.
As myself. So I never say I'm successful. For me, there could be numerous things in my mind where I said, I wish I had done this. I wish I had done this. I wish I had done this. I wish I had done this.
Sir, since we are on that page, any regrets? I mean, in such a huge, long career in cardiology, any major regrets?
I wish I could have given more time to my family, to my children. Yes, I do. I did spend a lot of time at work. I mean, that's the only thing I've done is, of course, I've given them time, but I wish I could have spent more time. Agreed. And that means time every day. That doesn't mean time at weekends. That doesn't mean time at holidays. It means time every day, every evening, I wish I'd been able to do that. I guess you can't do everything. But if I had to relive this life, somewhere I would actually say, maybe. But who knows? If I had spent time somewhere else, there's a lot of traveling I have done, a lot of lectures I've given, a lot of live demonstrations I've done, a lot of patients I've treated, and a lot of creations that I have done. That took up a lot of time in the whole day. So see, the biggest look why I say that. One of the memories of my early part of my children is when so intent at work that I would get home, and till very recently, I'd say, I would get home at 11:30, 12. I've been at home at 6 o'clock in the morning, working throughout the night, multiple times. Or 2 o'clock or 3 o'clock was never an abnormality to me. In fact, leaving for work, leaving work to go home at 8 o'clock in the evening seemed alien to me. It was impossible. I never even believed it. It was for me half day, because the norm was 12 o'clock at night. And that means days on and on and on. So it just didn't mean. So abnormality was, and 7 o'clock, I'd never seen what the roads look like 7 o'clock. And I'm talking to you till 2 years ago. And that is the whole of my life. So, and it struck me one day when I actually was away for 4 to 5 days. And I don't say with any happiness. I say it with a lot of unhappiness, looking back. And that's why I'm saying it. I was away for 4 days off to another country, and I got back and I got my daughter something. This is when she was in school, when she was in class 4, 5, 6 maybe. And she said, what is this? And I said, I had gone to Singapore and I got you this. And she said, when did you go to Singapore? And I said, oh, that was, 4 days ago. And she said, oh, really? I didn't know you were away. Now, I had not been there for 4 days, and she didn't know I was away, because I used to come home when she was asleep. I would meet her the next day briefly, or I could be asleep while she went to school. And then for her, it was a norm not to see me for a few days. Now, that's not a good thing. So I guess the message I'm passing on to everybody who wants to achieve success like me is that somewhere you're not fair to everyone. when you go for such a success. So don't aim for success. Let it come. Perhaps the biggest thing I would say I learned is that, there's somehow get a balance and still let them continue to work hard for your patients. But don't lose sight of everything else which is around you, because they do a lot for you to get to this position.
That's right.
And you need to be there for them also at that, in times of life.
Sir, since you mentioned Madam's name twice, she was your MBBS colleague. I mean, could you tell us a little bit more about her? There must be a lot of sacrifices.
She's amazing sacrifices. Yeah, amazing sacrifices. Yeah, just my colleague and my mentor, and has been a very integral part of whatever these achievements are all about. And therefore, yes, she gave up her career for the sake of mine. That's how our children have come up. That's how our children have done well, because she gave them a life. She then later on did well to do psychology and became a psychologist as well as a physician. And yes, so yes, I owe what I am today to, like I said, these sacrifices. And when you're so much engrossed in everything you're doing, it doesn't impact you that much than when you start looking back on your career and saying, how did I get here? And then every cog starts fitting into that wheel which actually made you here. Every step of that ladder wasn't created by you. Every ladder wasn't created by myself. The ladders kept coming and I was just stepping on them. And the ladders were being created by the others, like her. They were being created and I was just stepping on them. And I think this is a message for everybody, Success has to be an integral part of the success of everybody around you. It just can't be you alone.
That's right.
She's a family psychologist, she's a child psychologist, and the only thing she says is, I'm glad she says, I'm glad I became a psychologist. At least now I can figure you out. And you're my first patient.
Very right.
You're my first and the best patient.
Right. So many awards, so many degrees, so many jobs. I mean, I was going through your CV. I mean, what keeps you grounded? Is it at times mind-boggling? I mean, does it affect you in any way negatively ever?
It seems a lot, yeah. When I read it in paper, on a paper, I suddenly start looking at it and saying, "Itna sare is really?" And yes, I think I would say I'm privileged. I'm thankful. I'm thankful to God that He's got me into this position. Truly, like I said, I never thought it was meant to be like this. But yes, I guess a lot of blessings are coming through. As I look upon my career, I look upon my achievements, and I can only decipher them when I read about them myself, and I say, gosh, I've done this and I've done that. And yes, I have. It is more humbling. You know why it's more humbling? Then I think this is a very important aspect. Another thing which I think, the bigger you are, the greater you get. And of course, you're not saying you're great, but the more you get decorated and the more you get awarded and the more you get honored, yes. What does that happen? It actually creates even much more responsibility on you. See, it's a privilege and a prestige of mine to be iconic and inspirational for others. I have a responsibility to others. And how can I be a haughty person? After all, I'm the same person. And if there's a 20 years my junior who comes and sits on me, what right do I have to pretend to him that I'm such a renowned person, or I'm such an awarded person? For all I know, he's got even more talents than I have. There's no reason for me to look upon him or look down on him in any manner. I think I should be actually, if I'm going to be inspirational and aspirational for others, then I have to be what I truly am, which means I'm no different to anybody else. Could be I was just lucky to be in the right place at the right time. And yes, I had people who sacrificed for me. Yet I had the will of God, and that's what I'm here. But I don't think I can attribute it to me. So how can I be haughty about all this? How can I really be haughty about this? I sometimes say this, today I'd be walking down, I'm haughty. I say, look, these hands do so much. They can actually do any form of procedure with skills. And my driver shuts the door of the car on my hands. And tomorrow I won't be able to operate even a single person. Yes, it happened to me, just briefly around going back 16, 17 years ago.
Okay, sir.
Was it 17 years ago? Yeah, no, it's not that long ago. It was around 10, 12 years ago.
Okay, sir.
I had severe pain in the arm. It was cervical root compression. Started very rapidly. This is the reason I'm saying this to you is just shows you the fragility of our life, how we can think of how big we are and how we've been nobodies. And it goes down my arm to within 24 hours, 48 hours, I couldn't move this arm. And suddenly I actually could not. I was in severe pain throughout. I couldn't move the arm. I took off. I took leave. Then I started wondering what this is. I was told that it was strictly compression on the cervical spine. And then I started with physiotherapy. I had to put my arms on pillow to even come for physiotherapy from home. Then I went into acupuncture. That still didn't correct it. Of course, loads of medicine, high-dose steroids, nothing worked. And I was still 4 weeks later, I was in severe pain with muscle wasting. And I was now wondering what to do, because that's when I thought my career had gone. I thought, I've finished. This is over. This is done with. Ashok Seth, you're going to be a nobody. Maybe you'll get back to treating people with stethoscope, but otherwise, whether you can do your OPDs or not didn't seem. So 6 weeks later, we decided that I'd go abroad for a surgery. People didn't think it would be successful, and it was that. Until I decided that before going abroad, me and my wife decided that we have to take blessings of Baba and go to Puttaparthi, because that's where our whole faith and devotion lies. And I still believe that he's gifted me what I am today. So we go to Puttaparthi, and I still his blessings that and all this is going abroad for surgery. That I'm going to go abroad. This is the day. Let's see what happens to my arm. And I go there and I actually take a letter which is supposed to give to him to say, this is what it is, and can you please bless me as I go abroad for surgery? And he comes across and he doesn't take a letter, and how disappointed you are, when you're in that crowd with your holiness, with whoever it could be any spiritual person that you bless, and you are just waiting for someone to take a letter or that gift, and you think that he's just good. And he just stroked me twice on my arm as he walked past, and I just didn't think of it. And apart from asking my next person sitting next door, did he touch me? And he said, yeah, he just stroked you. And didn't you see that? I said, I thought he touched me, but he didn't take my letter. And I actually therefore decided, and then we came back, and before we flew, it started getting better. And over a period of 2 weeks, I was absolutely back to normal. Didn't go abroad for surgery, canceled that program, canceled everything. But what did that tell me? It taught me two things. It taught me the fact that I was a nobody, that I had gone, that I would not have even done an angioplasty thereafter, and the greatness was given by him. It also taught me that the greatness is his, God. I mean, whoever you believe is your supreme power, but there is a supreme power. That's the one who actually looks after you. That's the one who teaches. That's the one who takes care of you. That's the one who actually brings you to where you are. And if he could, if no medicine could actually get me better, and if it was that faith which got me better, then I have to continue that faith. And then you're seeing a sensible, achieving doctor telling you, when you actually sit there, an achieving doctor telling you stories on faith and how faith can heal, how spirituality can heal. I'm a clear example of 3 days after that stroking. In fact, it was actually at 12 hours that I started feeling better. By 3 days, I felt, but before that, I thought I'd feel stupid if I was to tell everybody around me, including my family, that I was already feeling better when everybody had actually planned tickets, bought, and ready to leave on Wednesday, and this was on Sunday that we were returning back from Bangalore. So I'm not talking about him. I'm talking about the spirituality part of it. I'm talking about whoever you have faith in. But I'm talking about the fact that there is a super power who does good to you. So, and I was better in 3 days, and I haven't looked back. I haven't looked back. Yeah, this story actually goes back. It wasn't 10 years ago. It was longer than that. It goes, and I've not looked back, and I continue to that. But it still reminds me that one day this could happen again. So if I was feeling so superhuman, God will put me in order one day straight away, saying, I told you the success wasn't yours.
Very touching, sir. Thanks for sharing that story with us. Sir, I heard you are a fabulous scuba diver and a fantastic singer also.
Yes. And I learned scuba diving in Mauritius. And my wife, fondly remembers the time because it wasted her whole holiday. Where I was learning scuba diving, and she had all this program sorted out, and I'd say, "Oh, just give me 2 hours, just give me 2 hours. I want to do this." And she'd wait till the afternoon till I came back, and then say, "Okay, now let's go." So this was in Mauritius, but yes, I learned a lot. And then I did a lot of scuba diving. Then after having learned that, I did Sharm el Sheikh in Egypt, one of the finest diving sites. I did the Great Barrier Reef. I did so a number of places. It's sad that over the last few years that I haven't done as much scuba diving I would like to. But what the COVID times reminded me is how much, and the same thing goes for music. I learned ghazals. I mean, avid ghazal singer. I learned it. I spent time of it. In fact, even to the extent that I held a concert. In Delhi. But I'll a bit more about that slightly later because that's funny, part of it also. But and then I am in this 1.5 years taught me that follow your passions, follow your continue. Never let your passions go also. They are a part of your life. You have to be passionate about patient care, have to be patient treatment, the cases, but you also have to give yourself time for those passions. And I missed out on the last 4-5 years on scuba diving. And I've decided that come this opens up, the first thing I'm going to do is spend a lot of time on scuba diving. I'm going to do a lot more. Even if they come to me, even if when I go there and they look at me and saying, "Are you sure this guy is going to really do scuba diving? Isn't he too old to do scuba diving?"
At all.
Thank you for saying that. They'll think that I'll go down and never come up. So I said, no, I'm going to ensure that I'm going to continue scuba diving and continue my passions around it. But it's tremendous. It's so serene when you go out there, down there. It's the most beautiful world that you ever see is the quietness and the beauty underwater where nobody can disturb you and you're absolutely lost in what you see around yourself. About this concert, yes, the funniest aspect, of course, the concert was a success, and a lot of who's who of Delhi were there. Many of them, as you know, are my patients, so they had to be there. So funnily enough, I don't think I sang. I thought I sang well because everybody who sings himself believes he's singing well. Okay,
absolutely. That's important.
It's the others who know how good he's singing or not singing. But there was enough clapping. But I'd said it very initially up front. I said, and I in that concert, that if you think I sung very well, my thanks to my Guruji, who's taught me, who was with me, by the way, at that time, and he sang, and he also sang ghazals, who taught me, and my appreciation for him. But if any of you think I sang badly, then remember, I'm a better angioplaster than that, and many of you have already had their angioplasties than and who of Delhi who actually had treated. So they all laughed, but they clapped enough. And then, of course, there were some who told me that at the end of the day, again, singing is something which gives you a lot of joy. It transcends barriers. It actually is something where you're humming a tune every time in your life. So again, that's a passion to continue and a passion to follow. Yes, I did. I must say, I don't think I was the greatest singer. There were some who actually told me where I had flaws, and therefore I appreciated the fact. But it also, I cut a CD and I subsequently heard it. When I was singing, by the way, I was so passionate that everybody say you sang with a lot of passion. So they would appreciate me, They'd say, "Oh, you were good. You sang with a lot of passion." They would say you sang well. It's only when you listen to your own CD, you say, "I thought I sang well, but this wasn't as good as I thought I was." But anyway, I did do a lot of training and a lot of passion and did the concert. And so, yes, it is something that I believe everybody should actually have. The ability to be, firstly, multifaceted, the ability to have multiple activities, enjoy them, imbibe them, and make them a part of your personality and life. I think that's so important. You cannot just be a unifaceted personality. That is not talent. That is not experience. That is not what you need to be with 30 years of all-round experience. You need to be a multifaceted person where someone sits with you, his aspiration, you have to inspire people in your life. And you can't inspire people if you're a unifaceted individual who knows nothing else in life apart from your subject.
Right. So could you say two lines or say two lines for us? Anything which you think is of your choice, anything which comes to your mind.
I think you should continue the interview in further directions before you make me sing, because I don't think lots of people would appreciate it. It's my voice has gone hoarse, and so much has happened since yeah, one of the saddest things which happened, I must tell you, recently around all this is that the Guruji of mine, who actually was responsible for teaching me, training me. In fact, his passion towards me was so strong that if I would miss classes, that he would give me a call. He would actually remind me that you haven't come for classes for, when I lost track or became so busy that I missed out going to him for 6 months, but he would keep pestering me. He got me back again to him. And he was the head of the Sangeet Vidyalaya, the Bhatkande Sangeet Vidyalaya in Delhi, and very passionate about my singing. Passed away during this COVID. Okay. And that was so sad. That was so sad. Of course, this surge of COVID was bad. It really created a realization for how fragile our lives are. And he was one of them who passed away during this time. So that hurt me a lot. And yes, I will again get back to singing. I suddenly wondered who, how, where I would do it, because I was so attached to him that it was a bonding. I started singing when it was 2005, and I think I did that concert in 2009 or 2010. And he was such an integral part of that journey. Of course, I will get back to that journey. So next time when we are at an interview, I will be singing.
Sure, sir. Sure. Sir, where do you see interventional cardiology in 10 years? The way we are progressing, the way we have started replacing valves, valve in valve, and I think mitral valve replacement is not far away. Where do you see interventional cardiology going in a decade's time?
So the biggest growth of interventional cardiology has been in two arenas. Firstly, extreme high-risk angioplasties, and therefore being able to do those procedures which we could not dream of doing maybe 10 to 15 years ago. And the second is the structural heart therapies. But if you see, both of them have come through with a close cooperation and collaboration with the surgeons.
Very right, very right.
We look at our earlier lives of balloon angioplasties, bare metal stents, and drug-eluting stents. It was always a debate, disagreement, always in a fight and an argument between the surgeon and the interventional cardiologist, each trying to preserve the turf. But now it's more a collaboration and a cooperation, and that's why we progress so rapidly towards doing those very techniques which were 10 years ago unbelievable. Okay, so on the interventional cardiology, coronary artery disease, PCI side, we do left veins, we do a complete revascularizations of even failing hearts with severe LV dysfunction on impella supports, on percutaneous supports. We have so many tools and technologies to be able to revascularize, be it CTO therapies, be it calcium therapies to treat calcium, be it left vein bifurcations. You see it. And you see the arena which has developed in the last 10 to 15 years is huge and immense. Almost things you thought were impossible to treat earlier on. And then the same goes for structural. And yes, we're going to go more and more into being less and less invasive in collaboration and cooperation. The good part is, as cardiologists, that we do enough trials and prove that these techniques make a difference and are superior to the ones which are previous. And that has clearly been our rigorous agenda as interventional cardiologists. So yes, I do see valve therapies, structural therapies progressing in an immense manner, being less and less invasive. Of course, bypass surgery is always here to stay. Angioplasty is here to stay. And we're going to have more and more overlaps of working together, creating a single dimension, single direction of doing many of these therapies in more simplified manner with expertise from both specialties pitching in, and therefore giving the best outcomes of our patients for most complex disease processes in the simplest possible manner. Now, I think the bottom line is giving the best to our patients, giving the best outcomes to our patients. And that is why, therefore, we start believing that it's no more the world of interventional cardiologists or the cardiac surgeons. We are structural therapists, we are vascular therapists, we are coronary therapists at the end of the day, where we're going into the realms, and we have to more and more go in that direction to be the people. That's why we sit and talk more often now with the cardiac surgeons. That's why we're able to discuss more often. That's why the heart team philosophy came in, and the heart team philosophy is there to stay. I think it's been a great journey over the last 15, 20 years. I mean, from the first, you were well aware that the first ever proof of concept of a transcatheter valve, a self-expandable valve, the first in human study happened with us in India in 2004, the first ever implantation. It was the most transformational moment of any of my life as an interventional cardiologist, to see something which actually on table, a valve got changed, and that was a transformational moment that I could never achieve, never believe that could happen in front of our eyes, and that happened in this very lab. And that's the sort of pioneering spirits which has transformed the arena of treatment of heart disease. I think it is huge. I think we have to be feeling privileged, to tell you frankly. I must say that in this journey, when I look back, I feel that I'm privileged to be a part and have contributed to some of the most fascinating progresses of science and technology which could have ever been seen in the last 30 years. And to be an integral part of it, to put India on the world map, to actually have contributed to it, has been a privilege of having been born in that time. And again, like I said, a privilege of God above as a default strategy for making me an integral part of this journey. But what does this actually do? It gives such a huge responsibility that you just can't thinking ourselves of being gods, because if we actually believe that our advancements in science and technology of the last 30 and 40 years make us demigods, then you're so wrong. Like I just said, that if we want to live on this world, on this earth, then we can live as demigods. But isn't it just this submicroscopic non-living particle which showed the fragility of humankind and stopped the whole world in its tracks? It changed the way we talk to each other. It changed the way we sit around and eat on the table. It changed the way we interact with each other. It changed the way we actually travel. It changes the way that we teach. It changes the day we attend meetings. It changes the way which students go to school. It just doesn't change. It changed education. It changed everything that we ever knew. It made past alien to us and the submicroscopic particle. So what does it actually mean? It means that you just can't live with science and believe you're gods. If you want to live on this earth, you might want as humankind to be superior to everybody else. But if you want to live on the earth, you can do that. But if you want to live on this world, you have to combine in 21st century, you've got to combine science with spirituality. That is what it means. That unless the science exists with spirituality, let us not be so enamored by our achievements. Let us not be so enamored by science. Let us not so be enamored by technology. Because fortunately, we lived in that area of science of 20th century, which saw the greatest amount of science. It was only 1904 when Kitty Hawk, that plane flew for 100 yards, and yet man landed on the moon by 1969. The first computer by Zeus came out in 1944, and we had a World Wide Web. Or by 1980, we had a World Wide Web. So we've seen such technology that it has enamored us. So, but let's, as we go into 21st century, let's be more God-fearing, as I would say. Let's understand the fragility of humankind. Let's know that there's another power which governs us and looks after us. And whatever we do for people around us, for ourselves, for our patients, for each other, has to encompass that spirit that we have to be there for everybody around us. From every small speck, for the plants, for the trees, for the birds, for the flowers, for the animals, for everybody has to coexist, and we have to learn to coexist. And if we learn to coexist, we'll have a better life. And that's what this whole life is all about.
Very right, sir. I think that was a fabulous note to end this interview with. Anything else, sir, you would like to say, or as concluding remarks, or anything else, any message to the youngsters?
Yeah, my concluding remarks to the youngsters is, and I look upon you as an aspiration. You're the millennials, you're the fast thinkers, you're the doers. Your mind moves at much faster rate than it does for me. Quite often in my work where I teach, when a lot of young gen interventional cardiologists are around me, learning techniques, learning technologies, getting awed at what I'm doing, little do they realize that every day I'm learning from you all. I'm actually getting inspired by your skills, your thought processes, your all-round achievements. And I mean all around, very different to the way I got focused on one thing only. Your all-round achievements, your multiple talents, the way you carry your lives forward in a new millennium, the number of aspects you put together in your own lives to think and make it a success. Your definition of success is a very different definition of success of what I created a definition. Like I said, it came to me, but what I thought of as success in my early part of my career is not your definition of success in the early part of your careers. And I think that's something to learn from. I think that there is so much I learn from you all that I say, continue to think vast. Continue, we say focused, but this focus which I talk about now is very different. The focus is this vast, and that is your focus. It is not this which is a focus. The focus is a wrong terminology. Your vision has to go broad as much as has to go long. And everything that you do has got to encompass the fact that there is no ceiling, that you actually create your own ceilings. You go so high in your thought process because it is all achievable with what I have told you. You just need blessings. You need his will. You need his vision, and you need to believe in him. Every day you go out from your homes, you say, God, let's do things today which helps everyone and which saves every life and which saves every patient that I touch. Don't put anybody in trouble. And then you come home, you say, thank God that through me, she actually made so many people better. And actually pray. And even in the worst of situations, even in the worst of circumstances where something is going wrong with a patient, where actually you feel that the things have gone out of your control, and you pray and you pray and you pray, and the things come back into your control. And you later on realizing, gosh, I just prayed and I prayed and it happened and the patient came out of it alive. I thought he was not going to come out of it alive. Well, that's the message that you are actually going to carry, that you believe in yourselves, but only believe in yourselves with one more person. There is somebody up there and you've got to believe in him beyond your belief in yourselves.
Thank you so much, sir, for these words of wisdom. This, I think I tried to get that man behind this huge name, Dr. Ashok Seth, a handsome man, a spiritual scientist, I can say, sir. And thank you so much. It was really a pleasure connecting with you. I'm sure all our listeners are going to be benefited by this. Thank you for your time, sir. Thank you.